The bag technique is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness to save time and effort, with the end view of rendering effective nursing care to clients. The public health bag is an essential and indispensable equipment of a public health nurse which she has to carry during her home visits. It contains basic medications and articles which are necessary for giving care. The rationale is to render effective nursing care or member of the family during home visits. The following principles are essential when performing the bag technique to achieve the best results or desired outcomes. Number 1, performing the bag technique will minimize, if not prevent, the spread of any infection. Number 2, it saves time and effort in the performance of the nursing procedures. Number 3, the bag technique can be performed in a variety of ways depending on the agency's policy, the home situation, or as long as principles of avoiding transfer of infections are always observed. Number 4, the bag technique should show the effectiveness of total care given to an individual or family. There are special considerations. Number 1, the bag should contain all nursing articles, supplies, and equipments that will be used to answer for emergency needs. Number 2, the bag and its content should be cleaned very often for supplies, replaces, and ready for use anytime. Number 3, the bag and its content should be well protected from contact with any article in patient's home. Number 4, consider one bag and its content clean and sterile, while articles that belong to the patient as dirty and contaminated. Number 5 is the arrangement of contents of the bag should be one of the convenient to the users, facilitate efficiency, and avoid confusions. The equipment is the public health bag that contains basic medications and articles necessary for giving care. And the content of the bag are paper lining, extra paper for making bag for waste materials or paper bag, linen lining, apron, hand towel in plastic bag, soap in soap dish, thermometer in case, 2 pairs of scissors, 2 pairs of forceps, syringes 5 ml and 2 ml, hypodermic needles, sterile dressing, sterile cord tie, dressing, tape measure, and the 2 test tubes, baby scale, 1 pair of rubber gloves, medicines, betadine, 70% alcohol, acetic acid, hydrogen peroxide, adhesive plaster, and alcohol lamp. Upon arriving at the client's home, place the bag on the table or any flat surface lined with paper lining, clean side out. Put bag's handle or strap beneath the bag. Next is to ask for a basin of water and a glass of water if faucet is not available. Place this outside the work area to be used for hand washing. Open the bag, take the lining, and spread over the work field or area. The paper lining clean side out, folded part out to prepare the work field. Next is to take out hand towel, soap dish, and apron and place them at one corner of the work area to prepare for hand washing. Next is to do the hand washing. Wipe dry with towel. Leave the plastic wrappers of the towel and soap dish in the bag to prevent transmission of microorganisms. Next is to put an apron right side out and wrong side with crease touching the body, sliding the head into the neck strap. Neatly tie the straps at the back to protect the nurse uniform. Next is to put out things most needed for the specific cases like thermometer, basin, cotton balls, waste paper bag, and placed at one corner of the work area to have them readily accessible to save time and effort. Next is to place waste paper bag outside of the work area for discarding of soiled material and close the bag to prevent contaminations. Next is to proceed to the specific nursing care or treatment to give comfort and security. After completing nursing care or treatment, clean and alcoholize the things used. Then do the hand washing again for infection control. Then open the bag and put back all the articles in their proper places to organize things and prepare for living. Next is to remove apron, folding away from the body with soiled side folded inwards and the clean side out. Place it in a bag to prevent spread of microorganisms. Fold the lining, place it in the bag and close the bag to avoid spread of microorganisms. Make post-visit conference on matters relevant to healthcare, taking anecdotal notes preparatory to final reporting. Write down all the necessary data that were gathered, observations, nursing care, and treatment rendered. Next is to make appointment for the next visit, either home or clinic, taking note of the date, time, and purpose for follow-up care.